How do our hormone levels impact how we look, feel, and perform? Today you're going to learn about testosterone, estrogen, and progesterone and how they impact our metabolism, our mood, our stress levels, and our energy levels. If you're listening on the Apple Podcast app or on Spotify, make sure you hit the follow button. And if you're watching on YouTube, make sure you hit like and subscribe below so that you don't miss any of the newest episodes that are going to help you look and feel your best. Today, I'm excited to introduce you to Megan del Corral. Megan is a clinical director and co-founder of Vidal Medical. Megan's a double-boarded and certified nurse practitioner with over 16 years of medical experience. Megan has an extensive background in complex endocrine and metabolic disorders and is certified in hormone replacement therapy. Megan underwent extensive training in women's health at the Cleveland Clinic Hospital and has completed in-depth training in bioidentical hormone replacement therapy certification through WorldLink Medical. In today's episode, I'm really excited because we're going to talk about a few different things. Number one, what common issues men and women are experiencing nowadays with their hormones. Number two, the top 3 lifestyle factors that actually impact our hormone levels. Thirdly, we'll talk about 3 tips to improve your sleep and stress levels. And then lastly, we'll talk about 2 of the neurotransmitters that play such a large role in our mood and our energy, and then what we can do to actually manage and influence those neurotransmitter levels. So this is probably something you've never actually heard before. So excited for you guys to dive into this. So for now, it's time to get closer to your best you with Megan del Corral. All right, what's up, everybody, and welcome back to the Best You podcast. Today, I am really excited to be joined by the one and only Megan del Corral. Megan, appreciate you joining today. So I want to dive right in. Basically, I want to today discuss hormones and the role that they play and how they make us look, how they make us feel, and how they make us perform. I definitely have a limited understanding and a limited knowledge myself on hormones, which is why I have you here. But it's my understanding that maybe 3 of the big ones that affect how we look, feel, and perform a lot are testosterone, estrogen, and progesterone. So we can go into those and others as well as you see fit. But the way I want to kind of start is how hormones impact our metabolism. So tell us, and even more particularly, maybe how hormones might impact our ability to burn body fat or how hormones impact the storage of our body fat. So let's start off with kind of hormones and metabolism, and I'll let you run from it from there.
Yeah, sure. Thank you for having me. Very excited to be here. And yeah, so we're talking about reproductive hormones when you're discussing testosterone, estrogen, and progesterone. And the conversation with progesterone is primarily with women. There's a small amount with men, especially if we're dealing with more conditions of the brain or traumatic brain injury. But the downregulation, so the natural decline in hormones, which begins usually around after the 3rd decade of life, different for everybody, and depending on your genetics and your lifestyle and how you care for yourself and your pillars of health, can show up differently. And the accumulation of whether it's subcutaneous, so under the skin body fat, or what we worry about more is the fat that accumulates around our organs or visceral body fat, is directly correlated usually to that declination in reproductive hormones. Like the term dad bod is the natural process actually of males, so biological males, testosterone converting, which is a process called aromatization, into estrogen. And that estrogen usually accumulates around, for men, the top of their abdomen, love handles, sometimes excess pectoral tissue. And for women, biologically, we were all put on this planet for one reason, and that was to make babies. And so when reproductive hormones start to naturally decline, as what happens in peri, which means before or around menopause, and then through menopause and in the postmenopausal female, our body essentially is like, okay, so she's no longer producing estrogen from her ovaries. Estrogen is stored very much in fat tissue. So our body then again wants to hold on to it because it's always kind of striving for what it knows best, which is to have a balance of hormones and have an abundance of them. So it doesn't really know what to do when that chronological biological aging occurs. I think one of the most important things I always remind my patients when we're having a consultation and we're discussing hormone dysfunction, dysregulation, is that replacement therapy, so the art and science of prescription pharmaceutical grade hormones, is an incredible tool for extending their health span, their lifespan, performance in the gym, performance cognitively, because these hormones play a big role on our cardiovascular health and on our brain. But it would be unethical to say that replacement therapy is a weight loss strategy for most individuals. Men, maybe. If a male comes in and they really have significantly low testosterone, which is called hypogonadism, sometimes that can help them lose weight for sure. I rarely see that though with women. Again, it can help them feel better and engage in other behaviors that then helps them lose weight. But unfortunately, weight loss is not always, number one in terms of symptom relief. We take care of a lot of other things, but that's kind of the long and short of that, summarizing body composition and hormone declination with age.
Okay. So let's talk about, you discussed replacement therapy, how it can be a great tool for a lot of things health related. I guess, and it depends on obviously like which hormone replacement therapy to undertake. But let's start with lifestyle. What are some lifestyle things, and what do you think it'd be more efficient to go through it like one hormone at a time, with regards to what impacts from a lifestyle perspective each of the different hormones, or can you talk about it generally speaking, or should we start one hormone at a time?
No, I think we can intertwine
Okay.
generalities and some specifics. And first and foremost, everyone is obviously individual, but kind of going back to, okay, we're all here for one reason, which is to procreate. Part of that is the kind of old school thought of, courting or going out and finding a mate. And unfortunately, in my practice, and I've been doing this for many years, I see low hormone levels, especially for men at younger and younger ages. And I have to believe, because, the way that our hormones are produced, it actually starts from with a signal from the brain down to the testes for men, the gonads, and for women to the ovaries, to then make biologic hormones. And there's a lot that goes into that process. So if our brain isn't getting the signal that we need as a male, you need testosterone in order to go and date someone, vet them. There's it used to be the waiting period before intercourse and all this stuff. You kind of lose a lot of that machismo of like that, like, fight or flight, kind of like, I'm going to go out and hunt for my family, right? Um, and so low hormones for men, especially, what we see a lot, the most common symptoms I see is general fatigue, lack of motivation or drive. And sometimes this happens because it's, someone who's in their 40s and 50s, they had a lot of really great testosterone and other biological hormones like growth hormone, and they've just kind of run themselves into a rut being, high achieving. I see a lot of CEOs, high stress jobs, high performing, and most of them then also choose CrossFit 5 days a week as their exercise modality, and like, sleep 3 to 4 hours a night. And so the body then goes into this starvation mode where it's like, okay, like he's trying to kill me. I need to, preserve where I can. It's obviously not a good time to bring life into this world, so I'm gonna not waste energy making hormones. So the lifestyle factor can really, be a double-edged sword, and we want to have all of our pillars of health in check: sunlight, relationships, exercise, nutrition, sleep, stress management, and send the right signal from the brain. So having healthy relationships, intimacy with a partner, that's consensual, species specific, age appropriate, all the things you have to say nowadays. And, lifting heavy weights. It's always interesting because I know a lot of your listeners are like me, are endurance, recreational or professional athletes. And I always remind people, like running a marathon is probably the worst thing you can do for your hormones. It's great for other things, and it's good for your brain, and, good for your heart health and bones to a certain extent if you're not overdoing it. But lifting heavy weights is probably a better way to send that signal to the brain to build testosterone. And then for women, again, we are so on a one-to-one basis, women actually have more circulating levels of testosterone than they do estrogen, which I think a lot of people are now privy to that understanding. So we also need a good amount of testosterone, not just for sexual health, because I feel like that's the first thing people think of is libido, but really to also help us, as you said in the beginning, look, feel, and perform our best. We want to recover from athletic endeavors. We want to have drive and motivation to take care of ourselves and our families and, again, engage in good relationships. And then the estrogen is a huge component, bone density. So if we are engaging in endurance sports, we want to make sure that, we're not having a lot of stress fractures because of collagen breakdown from low estrogen. Again, heart health, brain health, and then progesterone for women is always really interesting. So progesterone is the hormone that's highest when a woman is pregnant. So we always think of pro-gestation, pro-life. And it is the first hormone to start to naturally decline after age 35. And what happens with low progesterone, it has a pretty big impact on our brain. So when progesterone is low, there's a decrease in what's called GABA. And GABA is a chemical made by the brain, a neurotransmitter that's very much a kind of rest and digest, zen. And when GABA is low, it allows for an influx or high levels of glutamate. And glutamate is like this excitatory fight or flight. So how that presents to a lot of female patients is insomnia, anxiety, mood swings, mood instability. And so we're always kind of finding this, fine-tuning this dance. And my approach, with patients is always, okay, like let's start with some blood work and let's see how these results we see on paper really show up for you. Because first and foremost, I'm going to treat based off symptoms. And then we use, labs or blood work or whatever testing modalities in front of us as kind of a guide to understand what's going on internally.
Mm. Gotcha. So, man, there's so much there. I think a lot of people need to go back and take some notes. I'm excited. I want to dive more into progesterone side of things, and I really kind of like the neurotransmitter side of things, and how maybe a lack of healthy numbers in each of these can impact our neurotransmitters or impact our energy levels or impact our mood and stuff like that. So talk to us more about why do those things have such an impact over our brain and the neurotransmitters that are released?
Yeah, so our brain is super responsive. It's the gatekeeper. Like if you think about it, the heart is the pump, literally. So the heart's kind of like the little engine that could, and it's just gonna like keep plugging away. But the brain is like the master control center of the body, and that's what tells us we're safe, we're not safe. It's time to run from the bear. It's time to go to sleep. Our brain is, a master regulator. And all of these hormones, are found, or the receptors, which are like little sponges that all these hormones can attach to. Our brain has a lot of receptors that are specific to hormones. And when it senses one thing is off down, below as a signal down from the brain down to the body, and again, the gonads or other tissues that make hormones, it's going to try and sort out a chemical complex to make up for that imbalance. And testosterone, which is studied a lot in traumatic brain injury, is actually very anti-inflammatory and very protective for the brain. So when we have low levels of testosterone, one of the most common symptoms I hear about is brain fog. People be like, I just feel like I can't find the words. And it doesn't take much. I mean, you don't have to have a full-on CTE concussion, even playing soccer growing up, or, we all hit our head sometime as a child, I'm sure, not wearing a helmet, riding a bike. There's a lot that goes into, these kind of micro traumas to the brain. And the brain is very plastic and it can repair itself easily. It's not that everyone presents with a stroke. And then estrogen, I always think of estrogen as being very lubricating, not just in the vaginal tract, but in the walls and blood vessels of the heart. That's why estrogen is also good for men. Men should also have a little bit of estrogen. But same thing for the brain. Estrogen can provide a nice barrier for all these synapses or the parts of the brain to effectively do what it needs to do to send the right signals. And we kind of talked about it a little bit as well, but so progesterone has this impact on GABA and glutamate and their balance, which has an impact on our mood. And progesterone also really helps in the formation of what are called myelin. Myelin are like insulation for the brain. So it helps create a nice protective layer around the nerve fibers of the brain, which again help to create all the chemical signals from the brain down to the body. So there's a lot that goes on, which is why, if you think about it, conditions of the brain, so Alzheimer's, Lewy body's dementia, ALS, Lou Gehrig's disease, any kind of neurodegeneration usually happens in elderly people. And this downregulation of their reproductive hormones, we know, is a contributing factor. It's just, kind of goes back to is HRT for everyone? And it's definitely not. And there's no biological free lunch. So, we can't be putting it in the drinking water, so to speak. There has to be some candidacy and some risk and benefit for patients. But I definitely fully believe that you kind of want to hedge your bets, or if you're high risk for, you have a high genetic predisposition for imbalances of the brain as you age, I do think I would encourage that person to consider making sure their hormones are optimized appropriately for them.
Yeah, you said that nowadays you're finding men at younger and younger ages are having low testosterone. Is there any kind of like trend or more commonality that you're seeing with regards to women and hormone issues?
So it's interesting. We've had this uptick, and I don't know if we just are more aware. We're better at diagnosing it, which is probably the truth. I don't believe that we just kind of woke up and have polycystic ovarian syndrome, but I am seeing PCOS like out the wazoo, which polycystic ovarian syndrome, the kind of improper term for it, but the easy way to think of it is like diabetes of the ovaries. So it's a metabolic condition that then has a huge impact on the woman's ability to have appropriate reproductive hormones created by her ovaries. So very, very insulin insensitive or insulin resistant patients. And we are in the unfortunate process of that leads to a lot of infertility and heavier menstruation, endometriosis. What happens a lot, I'll get someone who is in their 60s and, taking a health history and, oh, I had a hysterectomy 30 years ago, whatever it is. And I always ask, well, why did you have a hysterectomy? She says, oh, I was having all these uterine fibroids and I was bleeding all the time, which are all signals of polycystic ovarian syndrome, this high buildup of their endometrial lining from a lot of excess glucose, glycogen, and estrogen. And at the time, that was the only cure. We'll just cut it out, right? Which we always laugh in the field that I work in. We're like, man, if men bled out of their reproductive parts, castration wouldn't be like the first option, right? But unfortunately for women, it's so common, like, oh, we'll just take it all out. And most of them are coming to see me now, maybe for HRT, but mostly because they can't lose weight. And I'm like, we have to fix the 30-year insulin resistance that's just gone on in your body. And, that hasn't changed just because we removed, your uterus. So, but yeah, I see a lot of infertility. I treat a lot of infertility, and I see a lot of PCOS and at younger ages as well.
So if somebody is having metabolic syndrome and insulin resistance at a young age, and let's just stick with females, what are some things that they need to be doing to both, maybe is it simultaneously reverse insulin resistance and balance hormones, or is there one before the other? Or talk to us a little bit about that process.
Yeah, I'm a big believer in the metabolic component, because I think that plays a huge role in when we look at health span and lifespan. So we want to live a long time, which is lifespan. But in the time that we're living, we want to be as healthy as we can be, right? And so that's your health span. I think improving the metabolic component first, and then you can add the hormones in as kind of icing on the cake, sealing the deal. Again, if their problem is they have so much joint pain and immobility because their hormones are so low, then maybe we'll start with a little bit of HRT at very, very conservative doses. But even then, I'm pushing mobility, getting a personal trainer, focusing on, step counts, walking, whatever their physical ability is. Then you can get into zone 2 training and all the other stuff, resistance training, sleep stress, pillars of health. And nowadays we are very fortunate that we have great tools at our tool belt. It's kind of a little bit of a rabbit hole, but the GLP-1 agonist drugs, which are the most popular drugs on the market right now, and everyone knows about them, they're a little bastardized. I think overall net positive, because cardiovascular disease is still the number one killer of Americans and I think adults globally. And we know by definition, metabolic syndrome is a foundation of this insulin resistance that then leads to, deteriorating our ability to get rid of excess lipids. And there's a whole chemical cascade between glucose and triglyceride levels, and then builds up all this plaque around the arteries and doesn't allow your heart to work appropriately. So, you can really quickly get into a big spiral. So my approach is, pillars of health, fixing the metabolism, hormones to kind of seal the deal. Because also, once we've had weight loss, even Mr. Olympia with all the drugs, if you're going to lose weight, you're going to lose muscle. And so I'm huge on my patients, like hammering into them, like, you need to hit your protein targets, you need to lift weights. So sometimes adding some testosterone in once they've lost weight really can help with that process and prevent age-related sarcopenia and the, continued degradation of their lean muscle mass.
You mentioned lifestyle factors a lot, and you kind of listed them out a decent amount earlier, and you talk about the importance of strength training and sleep and stress management. If you had to name like a top 3 lifestyle factors that have the biggest impact on hormone levels, what would be like number 1 that has the most impact, number 2, and number 3?
Sleep would be number 1 for sure. Sleep is where all rest, repair, everything takes place. That would be my number 1 for sure. Number 2 would be exercise. So, zone 2, VO2 max. And you have to remember, for some people, zone 2 could be a walk outside. For some people, it's rucking. And for some people, it's cycling. It doesn't always have to be running. And then 3 would be nutrition.
Let's say somebody hears that and they are having hormonal issues, and so they're like, okay, that's exactly what I'm going to do. I'm going to make sure I dial in my sleep. I'm going to make sure I get at least 7 hours, if not 8 hours a night. I'm going to make sure I exercise regularly, and I'm sure like a mix of maybe some higher intensity for the VO2 max, some zone 2 stuff, some resistance training, like adding in a good mix of that. And then they start to fine tune their nutrition a little bit so that they can, if they have any insulin resistance or metabolic syndrome, then they can start to work towards that. They're hitting protein goals, they're eating whole foods and stuff like that. Like how long do you allow somebody to like be consistent with the lifestyle factors until you look at it again? It's like nothing has changed. We need to go to like hormone replacement therapy, or we need to like work on something else. Like how long until we need to take a little bit more drastic measures, or maybe more like medical treatment?
Yeah, pharmaceutical intervention, usually 6 months. I give everyone 6 months. I always say, test and not guess. Like, so for instance, it's not uncommon. I see someone, it's the first time they've ever had blood work done, and everything is like in the red, it's like, it looks a little scary. I'm like, okay, like this is the starting point. And, exactly like you said, we're going to dial all this in, do nothing else. Don't buy 1,000 supplements or a bunch of programs, or like, jump into like whatever, hard 75 hard or whatever it is. Like, let's just move the big rocks because, the famous saying is without commitment, you never start. And without consistency, you never finish, right? My patients am really big on like, what can you do forever? And not that like you have to follow the same program forever, you can periodize it, but like, what are the things you enjoy in this health span? And let's capitalize on that and double down on those big rocks or retest in 6 months. If you still have metabolic derangement, then I'm like, okay, or you're still symptomatic, whatever it is, let's add in whatever it is, pharmaceutical intervention wise, whether it's prescription grade hormones or peptides or, GLP-1 agonists, whatever the treatment is.
Let's say somebody is struggling. I think that one of the things that also is known is like maybe sometimes like too much exercise. Like you said, if you do like a marathon, that might be the worst thing you can do for your hormones.
Worst thing for your hormones. And don't test them. Whatever you do, don't look. That's the worst time. I'll get a lot of people who do that. I'm like, why? No.
If somebody is trying to figure out, like they do love exercise and they're trying to figure out what is kind of like the optimal dosage for me and what's kind of the right balance of all these things, resistance training, high intensity, zone 2, like how would you recommend somebody goes about like being curious with discovering what the optimal regimen is for them and their hormone levels?
Yeah, I mean, if you're mobile and you have a base, right? If that's what we use like in running a lot, do you have a base? If you have a base of fitness and you're like, I want to see what I can do, that's where I think a periodized approach where you need to choose your goals. So I want to see what I can do for the 5 big lifts. Then you need to put all your chips in. You shouldn't be trying to like PR in the next 90 days. I always think in medicine, we do a lot. I don't know why. We think of a lot of things in a 3-month increment. I don't know where that started, but we do. So I always think of 90 days. So I'm going to spend 12 weeks focusing on my 5 lifts. Like, you need your hamstrings to be loose to do that. You need your quads to be recovered. So you probably won't be running. Now you can still do some swimming or whatever it is, some rucking for cardiovascular health, which can also help. And then, then you move out of that phase. And then I want to focus on improving my 1 mile time or improving my endurance, whatever it is. So I think that it's always good to have a periodized approach. This is where, I mean, a lot of people come in and they're like, I want to lose fat and build muscle. And I always say, we got to pick one. Like those two things are, unless you're a newbie and you're coming off the couch and you've done nothing for the last 35 years, maybe. But those are conflicting goals. It's like I have a lot of physique athletes I work with, and I'll get occasionally a female who's like, I want to get my pro physique card, which means they get very, very lean, but I want to also keep my period. And I'm like, that's not going to happen. Like, we got to pick one. Either you want to be shredded on stage or you want to be hormonally healthy, but that's not a thing. And anyone who tells you it is just selling you snake oil. Yeah. So my biggest thing is like, let's really focus, let's dial in and then we can always, transition our focus or move it. It's like an on season and off season, right?
Yeah. Yeah. No, I like that. I think focusing on different goals and having a periodized approach is important for so many different reasons, both like to keep you interested and like learning new things. And then also obviously, like you said, from a hormonal perspective, what is your, if somebody, I feel like sleep is people are continually learning more about the importance of it, but that doesn't necessarily always make it that much easier to do. What are some of your tips for, especially people who like have demanding careers, maybe have young kids, and then also like have maybe hormonal issues and stress issues? Like what are maybe some tips that you use with your clients to navigate improving sleep and I guess kind of stress on top of that with the demands of career expectations and family?
Yeah, we always have to remember that, like I always say, unfortunately we can't sell our spouses or our kids and quit our jobs and all become Buddhist monks. Like that's not the world we live in. We need to pay our bills, we need to show up. And I get it. Like it's not easy. My husband is like a world-class surgeon. We're up all night with calls and whatever. And, he has to perform all the time. So sleep in our house is definitely not perfect, but he knows like I'm obsessed with it. And when we can control it, we control it. The things that you can control, to improve the quality. One is temperature regulation. And nowadays, this is as easy as it can be. We have an 8-sleep mattress in our home, so it helps to cool down the bed for most people. So we want it. The idea is, Dr. Matthew Walker always says you want to warm up to cool down, meaning like sauna, hot shower, hot bath, jacuzzi, whatever it is before you go to sleep. And then so you're warm, you cool down. So getting into a cold environment, whether it's, turning down the temperature, putting a fan on yourself, and then stay cool throughout the night and then warm up to wake up. So warming up, so turning off your fan, increasing the temperature, whatever it is what helps wake you up with your cortisol. The other thing is remembering, and I always remind my patients of this, that your sleep that night starts the moment you wake up that morning. So delaying caffeine 90 to 120 minutes. So just simply not having caffeine. So you can wake up, get outside, morning sunlight. So take your kids for a walk, put your kids in a stroller, whatever it is, take your dog for a walk, but morning sunlight, delaying caffeine, and your sleep environment. I think those 3 things are huge. And then we always talk about the 3-2-1 rule, which I think it was Dr. Andy Galpin who came up with this, but it's no food 3 hours before bed, nothing to drink 2 hours before bed, and then no blue lights 1 hour before bed. So those are all things. I mean, there's 1,000 supplements and other things you can do, but I think those are kind of free pillars that I think play a huge role in your ability to create, a good sleeping environment, regardless of the situation.
I love that. Temperature regulation, knowing that your sleep that later that night starts the moment you wake up. And so you can maybe delay caffeine, get morning sunlight, and then sleep environment. I like that 3-2-1 rule. Andy Galpin is awesome. Yeah,
he's best.
Yeah, for sure. Let's, I kind of want to finish today with somebody has, I want to go back to the GABA and the glutamate. You mentioned how it's progesterone, how progesterone can impact those levels. GABA being the rest and digest, and you want that high at the right times to be able to relax and cool down, and glutamate being the excitatory fight or flight response. And when that's high, again, you might have like anxiety, depression, insomnia. Are there other things besides, what are the other things besides hormones, besides progesterone, that can potentially impact those things like GABA and glutamate to cause maybe anxiety, depression, mood swings, and things of that nature?
Sure. So chronic secretion or the creation of cortisol from the adrenal glands. Adrenals are they're like this big, this little bean-sized organs that sit on top of our kidneys, and they create what are called catecholamines, which are epinephrine, norepinephrine, phenylephrine, are kind of adrenaline, right? All those things sound like adrenaline, as well as cortisol. So the more that those adrenals continue to push out and they don't have time to recover, the more chemical imbalances we can have in the brain. So when we kind of going back to the pillars of health, when you get morning sunlight or sunlight in the photoreceptors of the eyes, so getting them directly in your eyes, which is why like looking through a window or a glass doesn't allow for this phenomenon. It allows for a nice production of serotonin, which again, serotonin is part of our feel good complex. And so a lack of sunlight or a lack of serotonin production naturally, whether it's through sunlight or engaging in healthy behaviors, self-care and whatnot, also can cause a lot of chemical disruption in the brain. The other thing is a hormone peptide called oxytocin. Oxytocin is released a few times. So during, what people think about the most is probably during labor. So when a woman's uterus contracts during labor, that's a release of oxytocin. But we also release oxytocin when we orgasm. So having a healthy sex life with your partner can help a lot with, again, kind of fostering that natural bonding. It's like a very love hormone chemical cascade. And you can also release it just from, cuddling with your kids, physical touch, things that make you feel good, watching a sappy movie can release oxytocin a lot. I think that's really important. And remember that our brain is really made up of three things, which is fat, water, and salt. So I talk to so many of my patients, barring they have normal kidney function, about the importance of sodium, which probably for a lot of your listeners, we think of sodium from fitness performance with, things like LMNT and all these electrolyte replacement drinks that are out there now. But sodium is super important in keeping all of the chemical processes of our brain stable. And if you're not eating a highly processed food diet, so you're trying to eat healthy, you probably are not getting enough sodium. So I always encourage people, and I recommend, 6 to 10 grams per day, like a pretty good amount. And I make people weigh it out, like measure it out. And I would say, okay, every morning, like weigh your salt or figure out, your electrolyte mixes to hit that, 8-gram target. And you have to do that every day. And you'd be shocked at how much better people feel.
So from a sodium perspective, let's say, like you said, if we're not eating highly processed diet, which is good, which we shouldn't, but there's just less sodium in our food, people are oftentimes low on sodium. And so let's say you're making 3 meals a day for yourself, you might, I guess, obviously certain foods have some sodium, and then obviously maybe like if you're putting salt on food, like you recommend maybe people measure out or weigh out 6 to 10 grams of salt and make sure you get that on your food throughout the day.
Yeah, 100%, regardless
Wow.
of what you're getting from like natural foods. Yeah. It's a lot, but especially if you're sweating, if you're exercising, and that just continues to go up and up, but you'd be surprised at how much better you feel. And sodium is actually also very good for those adrenal glands who make all of our fight or flight neurotransmitters. One hallmark sign of adrenal insufficiency or disease of the adrenals is actually the craving for salty food and salty things. And it's because that organ really, really thrives on salt. So I'm a
Mm.
big fan of sodium for sure.
And so you said it's important for the brain because sodium is required for a lot of like the healthy processes of the brain.
Yeah, it keeps the right amount of water and sodium, which is good. Sodium helps with electrical conduction, which is what the brain does all day. It fires all these chemical signals, also for your heart as well. Sometimes I'll get patients, especially if they've started on Ozempic or one of these GLP-1 agonists, we'll see a trend and an increase in their resting heart rate and a decrease in their HRV. If we get them to replace their sodium appropriately, that will naturally rectify itself.
Mm. If somebody is sorry, I'm going longer on this topic because I think it's super important, and I'm super interested in it. If somebody is getting their sodium levels tested, is that something that you can only really get tested in the moment? And if it's only tested in the moment, is it really an accurate view of what your sodium levels have been? And I guess, is that like a helpful thing to make sure you're checking on a semi-regular basis, or?
No, I don't know that unless you're really deficient or you have some congenital problem with your kidneys or you're not processing sodium. Yeah, the snapshot in the blood isn't really the best reflection. If you are looking for like, okay, I'm going to hit my 6 to 10 grams a day, and then I'm also training for I don't know, but an endurance event. I'm going to do a triathlon coming up. You probably need to be replacing on top of that. So I think what would be better is to do like the sweat test on the skin and see what you're losing and make sure that, during sport or, around your athletic training, that then you're replacing with whatever your mineral loss is in your hydration drink or in your gels, whatever it is.
Mm. What's the sweat test on your skin to know how much sodium you're losing?
So a lot of different companies make them, what's it called? It's perfect hydration. I want to say it's precision hydration or something like that.
And so this is basically a test that will provide you with feedback as to how much maybe sodium you lost in that particular bout of exercise, or is it like a rate of sodium loss?
Yeah, so it's in that bout of exercise, and you can do them multiple times. So precision hydration is the one that a lot of endurance athletes use, and they have a bunch of like it's an at-home thing, a sweat test you can do, and it will give you feedback at the little testing kit. So you can kind of take an average. You can test on, this is on a base, I always go back to running, but you can do it with cycling. So I'm just doing some zone 2 cycling for an hour and I lose X amount. When I'm doing VO2 max training, I lose Y amount. So when you're re-engaging in those similar workouts or training sessions, you kind of have an understanding of what your sweat loss is.
Okay, awesome.
Remember, the body is smart. It will, if it has too much of one thing, it will figure out how to get rid of it.
Gotcha. Okay. The last thing, back to the GABA and glutamate thing, I feel like that is probably something that is oftentimes off, which is causing a lot of psychological, emotional stress, anxiety, and stuff. What's the best way to know if like something like GABA is too low, glutamate's too high? Can you get your neurotransmitter levels tested?
Yeah, absolutely. You can. Best you can do through saliva or urine, but there are at home, I think ZRT, like those letters, ZRT is a brand that makes at home neurotransmitter testing, but yeah, you can absolutely test it at home and get an understanding of what your neurotransmitters are doing.
Is that something that you find valuable for people that are experiencing a lot of anxiety, stress, depression, or whatnot?
Yeah, absolutely. Especially if we're considering pharmaceutical grade agents, if I can have a neurotransmitter test beforehand so that we make sure that we're targeting the right things, it's always important. Test and not guess, for sure. Yeah, I think it's super helpful.
I love it. I love it. Well, this has been great. Covered a lot of different ground here, especially within the last 15 minutes, which has been super helpful. So if you guys want to make sure you go learn more from Megan, you can follow her on Instagram at Mouse Momentum, and you can also follow her company vidalmed.com, VIDAL med.com, and there's also an Instagram page at vital_coaching. Is there any other good place where people can go learn more about you and see all what you're doing and learn from you?
Yeah, I think Vital Med. And I'm not great at Instagram. I'm always working on it. But yeah, either one of those places. Part of our ecosystem is Vital Coaching. So we work with a plethora of health coaches under our consultation. And so they're really great and they have a lot of great information. So I think that'll be a good place for everyone. I appreciate your time today and great conversation and good interview questions for sure.
Awesome. Well, you guys make sure you go follow Megan. Make sure that you have taken notes on some of the stuff that you learned today about testosterone levels, estrogen, progesterone levels, things that are really impact your hormone levels like sleep, exercise, nutrition, some of the stuff that we talked there at the end with GABA and glutamate and improving sleep and sodium and all that kind of stuff because it's been super helpful. So I really appreciate your time today, Megan. I know everybody learned a lot. Y'all make sure you go to vitalmed.com, follow her at Mouse Momentum. But other than that, Megan, that's all we got today. Thanks so much.
Thank you. Bye-bye.
That interview was awesome. I loved the opportunity to get to dive deeper into the importance of hormones and what we can do to impact them both in a positive way and a negative way. Again, if you're on Spotify or the Apple Podcast app, make sure you hit the follow button. Hit it right now so you don't miss. And if you're watching on YouTube, make sure you hit like and subscribe below. We're continuing to put out some of the most life-changing content out there to help you achieve your health and fitness goals. My 3 biggest takeaways from Megan today are the following. Number 1, sleep, exercise, and nutrition are the 3 biggest lifestyle factors, and in that order, that can have both a positive or a negative impact on our hormones. Number 2, if you want to get better sleep, simplify things by number 1, regulating your temperature at night. Turn your thermostat down and take a hot shower before going to bed. By number 2, getting more morning sunlight each morning to reset your circadian rhythm. And thirdly, ensure you have a sleep environment that is distraction-free and phone-free. And then the third biggest takeaway is that GABA and glutamate, GABA and glutamate, are 2 neurotransmitters that can play such a big role in our stress and anxiety levels. Chronic secretion of cortisol, the stress hormone, can cause glutamate to be too high. Alcohol also increases glutamate, and ensuring you have enough sodium inside of your body, in your brain, especially if you are eating a whole foods diet, is important as well. Hormones are a complicated topic, and I'm just scratching the surface here myself. But sleep, exercise, and nutrition can be keys to help you regulate them, therefore getting you closer to the healthiest version of yourself and ultimately closer to your best you.